Hey y'all, so back to with the case study with our 70-year-old patient that presented with this. The final diagnosis will be stated at the end, and the interventions and tests that I am mentioning is for that final diagnosis. Let's get into it. Let's start with some low-hanging fruit. The patient's complaining of nausea and vomiting, and he has no known drug allergies or no other contraindications. Let's give him a little Zofran to get him comfortable. After the Zofran, we want to perform a few tests. We need to figure out what this is. We can start off with a histopathologic analysis, which is just basically a fancy word for skin biopsy. Because the patient has cancer, unfortunately, and he's on chemo, we're thinking this could be some sort of immune reaction because we noted that his WBCs were low. And for that, we're going to order or perform or assist with whatever your role is, a direct immunofluorescence test. That helps to detect immune-mediated dermatological disorders. Next, we want to do a serum antibody test, an indirect immunofluorescence test to help detect circulating antibodies in the patient's blood. Non-pharmacological interventions, we want to educate whoever will be caring for this patient on regarding their skincare to report signs and symptoms of infection. For this particular case, it's actually recommended to pop those bullae, those blisters, and drain them, and it helps to prevent the spread of them. So if a family member is going to be doing that, we have to educate them on the signs and symptoms of infection and when to report. In addition, corticosteroids topical, something like clobetasol, would be recommended for this. However, we have to be careful not to use excess because of the skin thinning that it can cause in the elderly population. Immunosuppressant drugs such as Imurin are also recommended. However, because this patient is already immunocompromised because of the cancer and the chemo, we're going to hold off on that for now. Patient is also complaining of itching, so we can do some Claritin. We don't want to do Benadryl, something like that in the elderly. And of course, we're going to do a derm referral. So now fast forward, we got all our tests back, and it has been determined that the patient has, drumroll, bullous pemphigoid. It's an autoimmune blistering skin disease often seen in older adults, particularly seen in ones that were in past wars. So shout out to the VA nurses. You all may see this on a regular basis. Let me know what you think in the comments and stick around for the next case study.